Good day, everyone. You are welcome to my YouTube channel, Everything Medical. In today's video, we shall be appreciating the anatomy of the cervical vertebra, precisely the first and second cervical vertebra, which is the atlas and the axis. If you are coming across to my channel at the first time, remember to subscribe, like, comment, and also share our video so that other students will see the video, the channel, and also benefit from it. Without wasting much of our time, let's quickly dive into the business of the day. Now, these two structures are what we shall be discussing under cervical vertebra, right? Now, you have to understand that the cervical vertebra is the bony skeleton of the neck. It forms this bony skeleton of the neck, and it is the most upper portion of the vertebrae we have in the human body. We have 33 vertebrae. 7 among the 33 forms the cervical vertebra. The cervical vertebra or the cervical spine is situated on the neck region, which I've said earlier that it is the skeleton of the neck region, which is situated between the cranium and the thoracic vertebra. That means if you are to locate the cervical vertebra, it extends between the cranium and also the thoracic vertebra, right? Now, the cervical vertebra is quite different from other rest of the vertebrae. It has distinguishing features, right? Now, here, this structure here is the first cervical vertebra. The first cervical vertebra, as you can see, this is the atlas, right? While this is the second cervical vertebra, which is the axis, right? As we proceed, we'll get to discuss them and also form the articulation. So this video, we shall majorly feature on their characteristic features, their articulation, which is the joint, and also their clinical correlations, right? Now, what are these distinguishing characteristic features of the cervical vertebra that makes it so unique from other vertebrae? Number one is triangular vertebral foramen. Now, as you can see, this is the vertebral foramen. Look at this on the axis. This is a triangular vertebral foramen, and this on the atlas is also a triangular vertebral foramen. What do? They allow the passage of the spinal cord, right? So the next feature is the transverse foramen. The atlas and axis has transverse foramen alongside with other rest of the cervical vertebra, which is ranging from C3 to C7. But the C7 does not have a transverse foramen. Rather, the vertebral artery passes on the outer border of its body, right? Because this is the transverse foramen, which is found on each of the transverse process. This is a transverse foramen. This is also a transverse foramen. These two lateral foramens allow the passage of the vertebral artery, the vertebral vein, and also sympathetic nerves. Look at it also on the axis. This is a transverse foramen. It's also a transverse foramen, which are found on the lateral mass of these bony structures. Another distinguishing feature of the cervical vertebra and other vertebrae is that the cervical vertebra is so much essential, right? It plays a huge role, and this role is dependent on its function, right? It has an odontoid process, which is responsible for rotation, right? Now watch. This is the axis. The axis has what we call dense odontoid process, right? It has what? Dense odontoid process, and also has what we call bifid spinous process, right? So the bifid spinous process is only found on the cervical vertebra, particularly the axis. As you can see, this is the spinous process, but it is bifid compared to other spinous process in other vertebrae. Its own is bifid. That means it is splitted in the middle, having distal bony projections. So it has a bifid spinous process, but other vertebrae have a pointed spinous process, but the cervical vertebra has a bifid spinous process. So the distinguishing feature among the cervical vertebra and other vertebrae is that it has a spinous process that is bifid. It has a triangular shaped vertebral foramen. It also has what we call the transverse foramina, which makes it to be different and unique from other bony structures. Now let's quickly discuss the atlas. The atlas is the first cervical vertebra. You call it the C1, right? It can be called the C1 vertebra, the first cervical vertebra. And it has no vertebral body. It has no vertebral body and it has no spinous process. As you can see on my hand there's no spinous process here and there's no vertebral body, right? Rather, it has what we call the lateral masses. The lateral masses, look at the lateral masses here. These things are called the lateral masses. This region is the lateral masses, while here is the lateral mass. So two of them are the lateral masses, which are connected together by an arc. So here is the anterior arc, here is the posterior arc. So here is the lateral mass, here is the lateral mass, right? That means these two lateral masses are connected together by an arc called the anterior arc, while these two lateral masses are connected together by an arc called the posterior arc, right? Now, on the anterior arc, particularly the inner aspect of the anterior arc, has a bony facet. As you can see it here, is a bony facet. This bony facet usually articulates with the dense odontoid process of the axis to form a joint called medial atlanto-axial joint, which is responsible for rotation, right? It is responsible for rotation of the head. Now watch. This is the axis. If you are to articulate it on this manner, you can see that the dense odontoid process of the axis form an articulation with the facets on the inner aspect of the anterior arc of the atlas to form a joint called the medial atlanto-axial joint, which is responsible for the rotation of the head. So that is how it works. Now, the lateral masses of the atlas has superior and inferior articular facet, right? So this is the inferior articular facet. Here is the superior articular facet. Now, this is how it articulates. So the superior articular facet, which is here, articulates with the occipital condyle. They articulate with the occipital condyle on this manner to form a joint called atlanto-occipital joint, which is a condylar joint of the synovial joint, right? It is responsible for nodding. It is responsible for nodding. And this joint plays a huge role for the posture of the head, which is mainly for nodding, right? So, as you can see that this is the inferior articular facet, which made an articulation with the condyle on the occiput, that is the occipital bone. We call it the occipital condyle, to form a joint called the atlanto-occipital joint. While the inferior articular facet of the atlas forms an articulation. It forms an articulation on this manner. It forms an articulation with the superior articular facet of the axis. This is the inferior articular facet of the axis, while this is the superior articular facet of the axis, while this is the inferior articular facet of the atlas, which forms a joint called the lateral atlanto-axial joint. Recall that this joint here, this joint on this region, which is formed by the anterior arc of the atlas and also the dense odontoid process of the axis, is called the medial atlanto-axial joint. It is also being reinforced and secured by a ligament called the transverse ligament of the atlas, right? That ligament usually winded on this manner, thereby protecting it. This one is responsible for rotation of the head, while the articulation between the superior surface of the atlas and also the occipital condyle is responsible for nodding, right? So you can see why it is called axis, because of the rotation of the head, like axis, different direction, right? But although it has a limit, if you rotate it too much, it might lead to lesion of vessels and also dislocation of the joint of the cervical bone, right? Now, the atlas also has a foramen on its lateral mass. Look at the foramen here, these holes, which allows the passage of a vertebra artery, vertebral vein, and also the sympathetic nerves, right? That is all about the atlas bone. Now, on the area of the axis is quite different from the atlas. It has a distinguishing feature. What that distinguishes the axis from the atlas is that it has a dense odontoid process, which is here. This is a bony projection, which is usually arise from the anterior portion of the axis. It forms an articulation with the anterior arc of the atlas. This is the anterior arc of the atlas. And that articulation is called the medial atlanto-axial joint, which is responsible for the rotation of the head, right? Recall that the superior articular facet of the axis, as is found on the both lateral mass, because this is the lateral mass, which is found on the both lateral mass, forms an articulation with the inferior articular surface of the atlas to form the lateral atlanto-axial joint, right? So there are two joints here now. This is the medial atlanto-axial joint, which is for rotation, while this joint here is also the lateral atlanto-axial joint. So that is how it works. Recall that the axis also has the transverse foramen, which is here, which also allows the passage of the vertebra, artery, vein, and sympathetic nerves. However, the posterior arc of the atlas has a groove which allows the passage of the vertebral artery also and cervical spinal nerve, the first cervical spinal nerve, the first C1 spinal nerve. Here is the groove. The groove is here. So the vessel wind around this region, the vertebral artery, and also the first cervical spinal nerves, right? The axis also has a process which I've explained previously, a bifid spinous process. You can see it's bifid. It is splitted to form a distal bony projection, the spinous bony process, which can be called the bifid spinous bony process. This is the lateral mass, the both lateral mass, which unite to form the bifid spinous process. Here is the superior articular facet. This is also the superior articular facet. Here is also inferior articular facet, which articulates with the corresponding cervical vertebra, which is the superior articular surface of the C3. That is the third cervical vertebra, because this is the second cervical vertebra, while atlas is the first, right? So that is how it works. Now, as you can see that there are mainly three joints here, three joints. One is between the superior surface of the atlas and also the occipital condyle of the occiput. That is what we call the atlanto-occipital joint, which is responsible for the nodding of the head. That is the nodding, right? The next joint is the joint called the atlanto-axial joint, which is the lateral atlanto-axial joint and also the medial atlanto-axial joint. The medial atlanto-axial joint is the one that is formed between the odontoid process of the axis and the facet of the anterior arc of the atlas, which is here. The next joint is the lateral atlanto-axial joint, which is formed by the inferior articular facet of the atlas and also the superior articular facet of the axis, forming the lateral atlanto-axial joint, because they are found on the both lateral masses. Look at it here, the both lateral masses. Here is the lateral masses of this bone, while here is the lateral mass of the bone. So the articular facet is found on the both lateral mass. They also have transverse foramina, which I've explained, right? Now, what are the common fractures? That is the clinical correlation of this bony structure. First is what we call the Jefferson's fracture of the atlas. Jefferson's fracture of the atlas is a type of fracture that occurs on the atlas, whereby there is a pressure exerted on the lateral mass of the atlas. Now, look at this lateral mass. This is the lateral mass. This is the lateral mass. So, when the pressure occurs on the lateral mass, right, it will lead to the separation of the anterior and posterior arc. Is either it leads to the separation of the anterior arc or the posterior arc. And when the fracture is severe, it can lead to the lesion to some structures such as ligaments and vessels. So the first clinical correlation of the atlas is the Jefferson's fracture of the atlas, which occurs as a result of the pressure exerting on the lateral mass, the both lateral mass, leading to the separation of the both arc. Either one or the two can be separated, which will compromise the function of the atlas, even threaten the joint, that is the atlanto-occipital joint and also the atlanto-axial joint, that is the lateral atlanto-axial joint. Even the medial atlanto-axial joint could be compromised on their function, right? The next clinical correlation is what we call the hyperextension of the vertebra. Hyperextension of the vertebra. When there is hyperextension of the vertebra, there could be dislocation of the joint of the vertebra. That is the joint that is found throughout the vertebrae, particularly on the cervical vertebra. So this hyperextension threatens the joint that connect the C3 and the C2. That is the atlas, that is the axis, and also the third cervical vertebra, which can also cause lesion to some certain structures and also compromising the work of the ligament, right? Now, the next one we shall be discussing is the hangman's fracture. The hangman's fracture occurs as a result of the injury or lesion to the pars interarticularis. The pars interarticularis is a bony column between the superior and inferior articular facet of the atlas. It occurs as a result of the high velocity hyperextension and dislocation of the head. That is what that leads to hangman's fracture. And when there is hangman's fracture, it can lead to lesion to some certain structures in the neck region, right? The next is the fracture of the dense odontoid process of the axis. When this bony structure got fractured, right, it can also lead to a vascular necrosis, whereby there will be no blood supply to some structures in the neck region because some certain vessels has been ruptured or lesioned, right, as a result of the fracture. So I believe you understood this bone. Thank you so much for staying to the end. I really appreciate.